Have you ever heard of lectins and their potential impact on gut health? If not, you're in for an enlightening journey today. In the vast world of nutrition, lectins are a type of protein frequently found in many plant-based foods. Now, proteins are essential for our bodies, but lectins are a bit different. They have a unique ability to bind to carbohydrates on the surface of cells in our gut lining. Sounds harmless, right? But some research suggests that this binding could potentially interfere with the integrity of the intestinal barrier, leading to increased gut permeability, a condition commonly known as leaky gut in certain individuals. It's a fascinating and complex topic, with the impact of lectins on gut health varying from person to person. So which foods contain these intriguing proteins? Let's find out. You might be surprised to learn that many common foods in our diet contain lectins. These include grains like wheat, barley, rice, quinoa, and oats. Legumes such as beans, think kidney beans, black beans, lentils, chickpeas, and soybeans are chock full of them. Nightshade vegetables, which include tomatoes, potatoes, eggplants, and bell peppers, also have a high lectin content. Nuts and seeds, specifically peanuts, cashews, and sunflower seeds, join this list as well. Even dairy has lectins, particularly the A1 casein found in cow's milk. Certain fruits like bananas, cherries, apples, and berries have lectins too, but they're usually well tolerated by most people. While these foods contain lectins, many are also nutritious and part of a balanced diet. So it's not about completely eliminating them, but understanding their nature and how they interact with our bodies. Now that we know where to find them, let's delve into what lectins actually do in our bodies. Lectins are known for their ability to bind to carbohydrates on the surface of cells in the gut lining. This interaction is a bit like a puzzle piece fitting perfectly into its matching slot. But just like a puzzle, sometimes things don't fit quite right. And this is where the potential issue with lectins and gut health comes into play. In some scenarios, this binding may interfere with the integrity of the intestinal barrier, potentially causing it to become more permeable, a condition often referred to as leaky gut. However, it's not a one-size-fits-all situation. The impact of lectins on gut health can vary significantly among individuals. Factors such as a person's overall diet, their gut health status, and their tolerance to specific foods can all play a significant role in how lectins affect gut permeability. So while some might experience gut-related symptoms due to lectins, others might not have any adverse reactions at all. If you're wondering how to manage lectin intake, we've got some tips for you. For those concerned about lectins and their potential effects on gut health, there are ways to manage their intake. Moderation is key, as many high-lectin foods are also nutritious and part of a balanced diet. Rather than eliminating these foods entirely, consider alternative cooking methods. Soaking, fermenting, sprouting, or cooking foods thoroughly can reduce their lectin content and help minimize any potential adverse effects. For example, soaking beans overnight and then boiling them can significantly reduce their lectin levels. Similarly, fermenting foods like sourdough bread can break down the lectins, making them easier to digest. Sprouting grains, nuts, and seeds can also decrease lectin content. However, it's important to remember that everyone's body reacts differently to lectins. For personalized advice, consider consulting with a healthcare professional or a registered dietitian who can provide guidance based on your individual health conditions and dietary needs. Remember, knowledge is power. Understanding more about lectins is the first step towards making informed decisions about your diet and health.